Hi, my name is Brad. I'm one of the nurses here.
I'm Brendan.
How you feeling today?
I'm okay.
I'm here to talk to you about your new prescription for lithium. Is that okay?
Yeah, thanks for coming to discuss it with me.
No problem. Lithium is a drug which is prescribed to treat bipolar affective disorder. It also helps, kind of treat bipolar depression as well.
Okay. How does it work?
It works by inhibiting chemicals in your brain. They're called neurotransmitters like serotonin, norepinephrine, and epinephrine. These chemicals are being overly produced, and lithium helps to reduce the amount of chemicals that are produced in your brain,
Hmm.
and therefore it helps stabilize your mood so you don't have as big of ups and downs that you've been having.
I think I was prescribed tablets. When do I take them? And how do I take them?
According to your prescription, you'll be taking between 300 and 600 milligram tablets 3 times a day.
Okay.
You're going to take these tablets with food or right after you've completed eating a meal. This is to help decrease the amount of GI irritation you can receive, and it also depends on when you and what your provider exactly prescribes you. There's a lot of different types of pills. So we'll look farther into that once your prescriber gets here.
Okay. I hear there's a lot of weird side effects with these kind of drugs. Is that true? Is there anything I should be concerned about?
Actually, yes, there are some adverse effects I want to discuss with you here. If you look here, there are many side effects that can occur. However, I'm going to go over some of the major ones that you should be aware of.
Okay.
These include arrhythmias, palpitations, hypothyroidism, which is when your thyroid produces too little thyroid hormone, and that has a lot of different side effects. We'll discuss that later. Trouble breathing, seizures, and worsening depression, and increased thoughts of suicide. If you notice any of these, the increased heartbeat, or your heartbeat doesn't seem like it's regular, or you can't breathe, or you do have those increased thoughts of depression and suicidal ideation,
Okay.
you should notify your doctor right away. However, do not stop taking the medication right away, as this can worsen those side effects that you're experiencing.
Hmm. Okay. Well, that sounds like a lot. There's not any more, are there?
There's just one more. If you look here, there's new studies coming out that say lithium toxicity can appear as a neurological issue. If you come into the hospital, they could misdiagnose you with a neurological issue.
Okay.
So I want you to be sure that you put this medication on your medication list and tell all your providers that you're on this medication, as though we can treat the toxicity sooner, and then there's no side effects from early recognition of lithium toxicity.
Okay. Should I be concerned about taking that? I mean, that sounds like a lot.
No, actually, this medication has been out for a while,
Hmm.
and therefore you need to realize that there's a lot of adverse effects that have come up throughout its implementation into the real world. This We are just informing you of this because we want you to be as informed about this medication as we are, and we can help treat you better.
Okay. I'm also taking this drug called Latuda. Is that going to be a problem?
Yes,
Can I
we
keep
have
taking that?
we have looked into that. Lithium and Latuda have been shown to have adverse effects when combined together. We will discuss this further with your provider, and we're also going to take a look at your medication list farther
Hmm.
and make sure that there is no drug-to-drug interactions, as we don't want those to occur.
Okay. Well, that's good to know. I heard something about labs. What does that mean?
Yeah, if you look here again, there's labs that you're gonna need to get regular blood work, as to make sure this medication is not at a toxic level or even too low. We want it at what's called a therapeutic level. This therapeutic level is known, to be very helpful in keeping the mood stable for a more consistent basis. We don't want any of those adverse effects that we discussed if your lithium level is too high in your body.
Okay. Well, that makes a lot of sense. I have a concern with my family not being able to accept this prescription.
Yeah, well, it's important for you to discuss your concerns with your physician and with your family, as we have prescribed this medication to help alleviate some of the symptoms from bipolar 1
Hmm.
that you've been experiencing. And I think it's important that you, your provider, and your family both know of your concerns.
Okay. Okay.
Do you have any other cultural concerns that you're concerned about?
No, I think besides that, I'm okay.
Okay,
Yeah.
really. Thank you for coming in and
Thanks for
letting me
talking.
talk to you.
Yeah.